Well, as fond as I am of all of you, I thought we would be past this point at this point in the summer, but here we are again. So that's okay. We've got some information to share with you all, and hopefully we'll get additional information out to the residents so that they can also have some information or the stats so they can make good decisions. So I think that I'll start by just giving you a little bit of information that was covered on our call with DSHS on Tuesday. They provided a snapshot of how things are going in Texas. And this 7-day average of cases has increased by 95% from 1 week ago. The hospitalizations in Texas have increased by 50% within that same time frame. At the beginning of July, just to give you a little perspective, the hospitalizations were averaging about 1,400 per day. And as of Tuesday, they were around 7,000. And when I checked yesterday, they were well over 7,000, almost 8,000 hospitalizations for the day. According to our state infectious disease doctor, at 10,000 hospitalizations per day, Texas hospitals are in major trouble. So we're not very far off from that. And I think you've heard that same message from Hendrick here in Abilene as well. Mortality has increased by 25% from 1 week ago. And a third of all the cases in the US are attributed to both Texas and Florida. So just the cases that are in those two states account for a third of all cases within the US. So we're obviously contributing significantly to the uptick in COVID. The Delta variant, as you all have heard many times in the news, is significantly more contagious. But just to give you an idea of how much more contagious, if you look at the original strain, each infected person, we expected them to infect between 2 and 3 other people. With Delta, the rate of infection goes from 2 to 3. That one person would likely infect between 5 and 9 people. So you can see the dramatic increase in contagiousness with Delta. The average age of hospitalizations has been another concerning statistic for us. The average age dropped about 10 to 15 years in a matter of weeks. So you'll remember that early on in the pandemic, the average age of hospitalization usually ranged between 65 and 68. As of yesterday, the average age had dropped down to 51 years old. So our message now is much different than it was in the beginning of the pandemic, which again focused more on protecting the elderly population, those who were 65 and older, and those who were immune compromised. The message now with Delta in the picture is really for younger people and especially the unvaccinated. This is the population right now that is at risk. So we've got about 73% of the 65 and older population vaccinated here in Taylor County, but we've only got still about 39% of those who are eligible, the 12 and older population, vaccinated. So we are lagging significantly behind the state, which is at 53%. This last week, we lost a mom who was in her 20s. If you looked at our death data, you saw that there was someone who passed away who was in their 20s. That was right here in Abilene. She was not vaccinated, and with her original death report, there were no underlying conditions that were reported. So I think that that really drives it home for a lot of people that you are at risk if you are unvaccinated. In a recent study that was published in the New England Journal of Medicine, researchers determined that against the Delta variant, just having one dose of the vaccine was only about 31% effective. when you get the second dose, it still is 88% effective. And this research was done using the Pfizer vaccine. So we've been hearing, it's a lot more common than we thought, that people are only getting one dose of the vaccine. It's so important to get that second dose. You're going from 31% protection to about 88% protection. And if you'll remember, originally when the data was released on efficacy of the vaccines, we were looking at somewhere between 94, 96% effectiveness with the original strain of COVID. But with Delta, it has decreased a little bit, but even with that slight decrease in efficacy, it's still our best tool that we have to combat COVID. So another statistic that the state shared with us, as of Tuesday, no deaths had occurred in any vaccinated people here in Texas. So I think that that tells the story in and of itself, with as many people that are getting sick right now, and even seeing some that are fully vaccinated continue to get sick, that is not the group that is dying from COVID. So again, very important to get vaccinated. And if you've only had one dose of a 2-dose series, please go back and get your second one. Even if it's been over 6 weeks, you don't have to start the series over. You can just go back and get that second dose. We're hearing a lot of people ask questions about, well, I've had COVID before, and so I've got natural immunities, and so therefore I don't need the vaccine. The studies that have been done have proven with some degree of certainty that if you've had COVID, you have natural antibodies, and those immunities really only last, as far as they can tell, about 90 days. So if you're beyond your 90 days from having had COVID, you also need to get a shot. But we can give it, even if you've had COVID, as long as you're recovered, you're about 2 weeks out, we'll go ahead and give you the shot. And it does provide that extra immune boost. Our infectious disease doctor also talked about an interesting phenomenon. So she talked about people who had a very light case of COVID. And so she said a lot of times that stays in the upper respiratory system. And so it doesn't really engage your immune system very well. And so with the vaccine, it's put intramuscularly. And so that really engages your immune system much more effectively. And so I thought that was very interesting too, that, you know, with people who had light cases, may not have developed enough of an immune response to really provide them with good protection. So getting the vaccine is still important, even if you've had COVID in the past. The good news this week is that vaccinations have increased by about 16%. So we are seeing people kind of realize that, oh, it's a little bit closer to home. They are coming in to get vaccinated. So that is a good thing, that they're taking these messages to heart. We've also seen people who have family members or close friends that have been affected, that once they see it hit a little bit closer to home within their own family and friend circle, they're realizing that they are at risk as well. I think the biggest concern for us right now in public health is that as we get closer to the start of school, we've got a whole group of kiddos that are not eligible to be vaccinated right now. And so one of the most important things we can do for anybody who is eligible to get vaccinated, you getting vaccinated provides a little bit of a barrier to protect the kiddos who are too young to get vaccinated right now. And so as we get closer to school, and we know that that is happening in person, it's even more important that you get out and get vaccinated if you have not been. I had my own 15-year-old vaccinated. My 23-year-old has been vaccinated. And so, you know, I realize in a perfect world, we'd have a vaccine that had been studied for years and years and years, and we would have the luxury of having lots of data to back up our safety, you know, standards. But when I weigh the cost of not vaccinating versus what we've seen so far with the safety data on the vaccine. My own decision was, I'm going to take a chance on a vaccine that has proven to save, hundreds of thousands of lives, if not millions. We know that millions and millions of doses have been distributed, and the safety data is overwhelming, and especially in the 12 and older population, the safety data is very robust. And so I choose to kind of lean towards the side of, I trust this data. I don't trust what COVID would potentially do to my child. And so I made the decision to vaccinate my own 15-year-old. If I didn't believe in the safety data, I would certainly not have done it for my child. I may have bitten the bullet and done it myself, but I certainly wouldn't have done it for my child. But I do believe in the safety of the vaccine. So it's just important for people to, I think that people really want to make a good decision, on both sides of the issue. People who are choosing not to be vaccinated right now or allow their children to be vaccinated, I know that they want to make a good decision. And I think it's really hard when you have people who can do a podcast or a blog and cite some information or a story that they heard as information, putting out there information that is not evidence-based is really dangerous. And so I just keep encouraging people to don't get your information from a blog, don't get your information from political figures. Look to the National Institute of Health, to the CDC, to your local health department, to the Department of State Health Services. Those are all scientific decisions, and it's based on research and data. So that's kind of the message that I'll keep pushing, is just get your information from reliable sources. We have medical staff here at the health department that's always willing to answer questions. If you truly just want to talk through something, don't hesitate to call up here. Talk to your own physician about how they feel about the vaccines and if that's the right decision for you and for your family. Doug, I saw that you asked a question. Are those vaccinated less contagious if infected than the unvaxxed? So there was a study that was put out that showed that those who got COVID even after being vaccinated had just as much virus in their system, a viral load in their system, as those who were unvaccinated, if they did get that breakthrough infection. So it provides protection for that individual. They're much less likely to get severely ill and have to be hospitalized. And of course, much less likely to die from COVID, but they can still infect others. And so I'm sure that there's lots more research to be done on that, but some initial findings indicate that they are just as infectious to other people as an unvaccinated person.
Thank you. I asked that because I'm vaccinated, both shots of the Pfizer vaccine, and I'm in day 4 of a 10-day lockdown with the virus. So,
oh, I'm sorry.
Yeah, I can't imagine what the unvaxxed must feel like when they get this, because it's no fun whatsoever.
Mm-hmm, mm-hmm. Well, yeah, thank God you are vaccinated, so you've got that protection for yourself, but definitely still important to stay isolated from others so that you don't pass it on. But hate to hear that. Sorry. Is there a hospital room shortage? How is the increase of cases affecting and or changing the visitor rules? I think Hendrik is on, aren't they? They're probably better to answer that.
I am. This is Lynn. Right now we're doing fine. The increase of cases, we're looking at every single day. No visitation to COVID patients, which has been in effect already, and we're looking at making some changes. So anyone from the media, I'm trying to set up a Zoom call with some of those changes We're going to do a little bit of changing in the dial as well as far as reporting. So I will send an invite to media for that later this afternoon.
And then I don't know if you can speak to a little bit, just with kids heading back to school. I know, and it's my understanding, so correct me if this is incorrect, but my understanding that, the districts are in a place where they cannot require masks. But, for me, I've got 2 elementary kids. We're vaccinated, but I'm having to kind of walk myself back through the whole understanding of we're vaccinated, but we're spreaders still. And so honestly, this is a whole new kind of level of seriousness, even compared to last year about now I'm, sending my kids to school with masks when not everyone's going to have a mask, and they're going to have to be in that position until I can get them vaccinated, So I don't know if you're in a position where you can, as a health district, give a recommendation about masks or not, or what you think with kids before they can get vaccinated.
So we have had good conversations with AISD, and their hands are tied. It is very frustrating to go back into school in person, and they definitely want to do that. There's great value in having kiddos in the classroom again in person, and so we want to preserve that for them. But at the same time, not being able to require masks is concerning, especially with so many who are ineligible to be vaccinated. So they don't have any intentions, and of course they were going to be presenting all of their safety protocols and measures to the board. But there will be situations with exposures where they are going to request masks. And so I'm not sure it will be their final decision as to whether they can require those in an exposure situation. So for example, if there is a positive in one classroom and that classroom is considered exposed, their primary contacts of that positive patient, the CDC recommends that they mask up. And so with using the same guidelines for critical infrastructure, you can mask up and return to work or school as long as you are without symptoms. And so we talked through that and what does that look like. So I think there will definitely be some situations where masking needs to occur for the safety of others if they are going to continue in-person learning for that classroom. But for us, 2 people or more is considered an outbreak. If you can tie those 2 cases together in a classroom or in a work setting or anything like that, that is considered an outbreak, even just 2 cases. And so those are situations where we want that classroom to go home and make sure that we stop spread so we don't have a much bigger issue. And the same is true in an office and a workplace, 2 people that caught it from each other, that you can link those cases. It's important to nip it in the bud, send people home, and if you can, and make sure that it doesn't get any bigger, because as we just mentioned, one person infecting up to 9 other people, that can get out of hand very quickly in a group setting.
Annette, would you recommend that vaccinated people return to mask wearing in public settings? Would that just be a generally good idea to do, given that we can transmit to other people potentially, even if it doesn't affect us?
Absolutely. So we 100% agree with the CDC based on information that is out there right now, where it appears that vaccinated people can continue to spread at the same rate. It is important to mask even for vaccinated people. And, let's just be honest, it's much easier to walk into a public place and when you see everybody masking, we're all doing it. It makes it much easier when you're one of few that's masking. You feel like, it's kind of like high school again. You feel self-conscious, like, people are judging me. There's strength in numbers. And I think if we all make the commitment to do it, and it definitely provides safety. I mean, we saw throughout the pandemic when that mask mandate went into place, you saw almost an immediate improvement. They really do help to limit the spread. Now, I'm not saying it's 100% effective. We all know that that's not the case, but it does significantly slow the spread. And so anything we can do to mitigate this is going to be absolutely necessary with Delta, and who knows what's coming next. I mean, we've learned, if nothing else, throughout this to never assume it's over. Somebody said something the other day about the 5th wave, and I'm like, are you sure it's only the 5th? This feels like the 75th, but who's counting? So, we've got to get some synergy together, all get on the same page and do things collectively. And it provides a much better layer of protection for our entire community if we will all do it. We all hate it. Nobody likes it, except my son does say that he likes, because he's more of an introvert. He likes hiding behind his mask. So he's all about wearing his mask for that reason. But for the most part, people hate it. We don't like it. But we're doing it for others.
Are we, I don't know if we have any statistics on this or not, and I think I may have asked this last time, but are we seeing anything about people becoming reinfected? Maybe people who have had COVID in the past and now they're being reinfected with Delta variant or anything like that? I'm not sure.
Yeah, there's not a lot of studies on that because I've looked for it. That's a question we get asked. The studies that I have been able to find, they focused on that first 3 months after people had been infected. And so that's where they based the 90 days of antibody protection from a previous infection off of. The rates are extremely low. I think it was like 1% of people actually got reinfected within that short time frame. But beyond that, 6 months out or even a year out, like myself, I'm over a year out from infection. I'm certainly not going to count on any natural antibodies that I might have developed initially with that initial infection. So there just aren't enough studies to be able to answer that. I don't think. If somebody finds one that's peer reviewed and that has been published, I'd love to see it, but it's just, they're few and far between.
Not meaning to monopolize here. I'm usually the quiet one, but any further word on boosters or anything like that? I think that's something that a lot of people are interested in.
Yes, that's another question we get asked all the time. And so I know that there are many people who are anxiously awaiting. They have started to administer in a couple of other countries. And so, I'm sure that scientists are watching those studies closely, anxious for information to be published about that. The conversations are happening, I know, at the national level with the CDC and those vaccine panels. So it's definitely being talked about, but I have not heard any sort of time frame about a decision. The other thing that they mentioned on the state call this week was the time frame that they anticipate for kiddos being able to be vaccinated younger than 12. Probably will not happen because of the timing. They have to have 6 months of safety data. And so the trials are in progress, but having 6 months of safety data does not happen until the end of the year. And so by the time all of that is reviewed, they don't anticipate that will occur until early 2022 before kiddos can start receiving vaccinations as well.
And with that, what type of advice would you give to those parents who are going to be sending back their kids that aren't eligible for the shot?
We're encouraging masking. I mean, I think that that's one thing that you can do that's fairly easy. Kiddos adjust very well. And so most of them don't have a problem wearing masks, especially if all of their classmates are doing it. So masking, continue doing all the things that we were doing before, doing hand sanitizer, making sure that they wash their hands frequently. Classrooms, teachers can have set times where everybody like, okay, it's time to wash our hands. It's time to use the hand sanitizer. Wiping down the desks, putting a child in charge of that is, children love to help. Have them wipe down their desks before they sit down, especially if they're changing classes. Continuing to do all of those things is important. Really right now, encouraging people not to gather in large groups. I know we really wanted to go back to being able to go to concerts and events, and I've had several community organizations reach out about different fundraisers that they had planned. And so we talked through that, and most of them really chose on their own to postpone those until later. Because it's just too risky, especially with things like a sit-down dinner. You have to remove a mask to eat, and you're right around everybody else. And so those are just risky activities that in this environment that we're in right now, with such a huge increase in cases, it's just not the safest thing to do. So if you can avoid it, if you can avoid large groups, don't do those things right now. We've actually talking to our epidemiologist the other day. She said that in case investigations that she's hearing about 44% of the cases actually cited travel. So we've had a lot of people traveling for the summer. And so quite an uptick related specifically to travel. So that's another high risk activity. And I know summer's dying down and people are kind of coming back home, but just be cautious. If you don't have to take a trip somewhere, this is probably not a good time to plan a trip, unfortunately.
Doug, since you're here, I know that Laura Gutschke is doing a story on Business Expo, and I think that you guys are going to have First of all, I'm sorry that you're ill, legitimately. I think you guys are going to have vaccination opportunity available at that. Is that
Correct, Brian? Yeah, thank you for that. I am obviously one of the lucky ones, and I think I've turned the corner on my symptoms. The big concern for me now is just making sure I don't inadvertently infect someone. So I'm hunkered down, which is just the most miserable part of all of this, for me anyway. We are to partner with the city. In fact, we're working with Mari currently. The city will conduct a vaccination clinic at the convention center during Business Expo. Now, Business Expo, we have talked at length about, do we proceed, do we not proceed? And we've chosen to go ahead and proceed based on the fact that we are going to be instituting all of the safety protocols that we had in place back during the original surge last year. So we feel that we'll be able to protect folks, and hopefully folks will choose to protect themselves in that environment. But there will be free vaccines available from the health department at the convention center simultaneous with the Business Expo. And I would look to Lauren Kusurik, who I think is still on the call. Lauren, if I have misspoken on that or misadvised, Brian, would you correct me?
Nope, that's correct. I sent a note to Laura this morning, letting her know that Mari and I connected late afternoon, and
Right.
Mari's work and her team are working on some graphics that we'll hopefully push out later this afternoon. Hendrick is also doing a blood drive at Expo. I want to make sure that that's noted because of how short on supply they are on blood. So a different little take to Expo this year, but we hope that by implementing the safety protocols and everything that we did last year, it will still be a success for our business community.
Thank you both.
Yeah, maybe we'll have like a tagline of like, don't back in the saddle, don't let spurs be the only thing that stick you? I don't know. Just kidding. You have to stop me.
Always so
I'm all
creative.
for the cheese, Mari. I'm for the cheese.
Whatever it takes.
I like it.
Awesome. Well, that's everything. Sounds good.
Okay. Thanks.
Awesome. Thank you, everyone.
See y'all. Hope you get better, Doug.
I'll send over the link as soon as I have it, Brian.
Thank you.